Good day everyone, I am Carl Salso Buenaventura and I am here to demonstrate gloving technique. So what is gloving technique? Gloving technique is a way or a procedure to wear your gloves correctly. So the purpose of this is to make sure that you do not contaminate the sterile part of the gloves, and it is a way to be more hygienic. So that's why we use gloving technique. So um, especially to invasive medical or surgical procedures, we need to properly wear our gloves to make sure that it reduces the risk of the patient to have microorganism inside their body. So, special considerations will be nurses that have allergies in latex, especially some patient na may allergy din sa latex. So, we don't want to touch them with a latex glove. So, that's the special considerations that I think. And so now I'm going to proceed with showing you how to properly wear a gloves. So I'm going to use a clean gloves, basically because I don't have any sterile gloves on my hand. So um, I'm going to now proceed with showing you how to properly wear your gloves. So right now I'm going to proceed with the procedures of wearing gloves. So I'm going to use a improvised gloves, sterile gloves. So bear with me. So I don't have any on-hand sterile gloves so that to be able to show you. But just imagine this is a sterile gloves. So now the first thing to do, or the first thing to consider when wearing a gloves, is make sure that you don't have a rings. And then you can remove your hand watch or wrist watch if necessary. So I'm going to remove it, so because it is so big that it can occupy my wrist, all my wrist. So um, um, now proceed with hand washing. So just imagine that I have hand washed and I'm going to use alcohol, so, or hand sanitizer. Next is proceed with getting your gloves. So remove the outer wrapper, peeling apart the side and lay it open on a clean flat surface. So you can see that I am going to um, um, I'm going to now put it in a clean surface, a flat surface to be exact, because kapag hindi siya nasa flat surface, the gloves can fall out, and sayang naman yung sterile gloves. So you will be using another sterile gloves because it is not sterile if it falls on the ground, which is not sterile. So that is the purpose of making sure that you put your gloves on a flat surface before wearing it, to prevent that kind of situation. So next is open inner wrap, so touching only the outside. So touching only the outside because, like I said, it is a sterile glove. So the inner part of this paper or this cover is sterile. So we don't want to touch the sterile part of the cover of the sterile gloves. So just imagine that I am gently opening the sterile part of the gloves. So now proceed with um, um, opening. Make sure that you identify the right and left glove. So I identify this as the uh, right and left. So this is the left and this is the right, so I identify it correctly. Going to secure both flaps open. So make sure that you don't touch the inner part of the glove. Inner parts of. So now proceed with grasp the inner fold with thumbs and first two fingers. So this is my non-dominant hand since I am a left-handed person. So I'm going to now pinch or grasp the inner folds. The inner folds is not considered sterile part. The outer surface is the outer surface of the gloves is considered as the sterile area or the sterile surface. So make sure you do not touch the sterile with the non-sterile so that you don't contaminate the sterile part of the gloves. So now I'm going to now proceed with wearing the gloves in my dominant hand. So you can see that this is my dominant hand since I am a left-handed. So now I'm going to grasp and then I'm going to now insert my hands gently. Since I'm only touching the outside, so you can fix it after you wear all the both gloves. So next is with dominant gloved hands, slip 4 fingers underneath. So like this. And then I'm going to now insert my, since baliktad yung pagka assemble ko nitong gloves, this is not the way it looks like when you do the sterile gloves. But since I am not correct, it's not correct position, so you just imagine that you wear gloves like this. So you can now proceed with adjusting the parts of the gloves. And now raise your gloves above waist. So the purpose of this is to make sure that you don't touch any surface, contaminated surface. So next is the doffing of the gloves. So the first thing to do is grasp the outside on the cuff with other gloves on hand. So make sure that you have both gloves on hands, or you are wearing both gloves on your hands. So now grasp the outside of on cuff with other gloved hands, and then pull gloves off, turning it inside out. So make sure that it looks like this. And then after that, make sure to crumple it like this to make sure that isahan lang yung disposal ng gloves and it will not separate on the bin. So next is use your index finger or so any fingers will do, I think, pero I'm more confident with using index finger. So you need to tuck it like this on the dominant gloved hand, so turning it inside out like that. So you can now dispose it properly without touching the contaminated area of the gloves. So right now, after assisting a patient, the all of the gloves is non-sterile, but the most contaminated area of the gloves is now the outside surface. So make sure that you do not touch the outer surface of the gloves after assisting a patient proceeding with invasive medical or surgical procedure. Make sure to note that, and properly disposal of the gloves. So that's all. Thank you po for watching.